Good morning, everyone, and I hope everybody had a good weekend and good health to each and every one of you. I'm just going to take my mask off right now. I want to thank again the continued collaboration and partnership with Baystate Health Systems and Mercy Trinity. Dr. Kerouac is here, who is the President and CEO of Baystate Health Systems, and Dr. Robert Roos, who is the Chief Medical Officer for Mercy Hospital Trinity Systems, is here. So we appreciate that. We are going to do, as we have done the last couple of times or 3 times, where Dr. Kerouac and Dr. Roos will present first and also take questions immediately after that, so they can get back to what they need, the important aspects that they have to do at Baystate and Mercy. So with that, let me give you a little bit of a brief update. This is a good trifecta that has come forth, a triple threat. I was speaking to Commissioner Helen Carlton-Harris over the weekend on a number of issues, but I think this could be the first time that we've seen any 3 days put in a row, but a Friday, Saturday, Sunday, maybe since the beginning of this COVID-19 coronavirus, where the cases, positive cases, Friday were 7 single digits, Saturday were 6, and Sunday 9. For a total of 2,537. So we are moving in the right direction. There is light at the end of the tunnel, and I want to commend the residents and the business community of the city of Springfield, and obviously my cabinet heads all the way down the rank and file. Systematically, it's shown that we are doing this the right way. We are not, and so too as Governor Baker on the state level, we are not seeing the huge spikes that are occurring across many states, a number of states in America. And that's important, because I've always said we're going to base this on the health, medical, and sciences, because it'd be demoralizing to take a step forward, then end up taking 2 steps back and have to re-shut things down. So we're going to stay true to this. The deaths, unfortunately, have moved up to 115 total, and God rest their souls, and my thoughts and prayers and sympathies and encouragement go out to the affected families and friends. Of that, 47.82%, 55 are white, 32 Hispanic, which is 27.82%, and black is 26, which is 22.6%. Of these deaths, 54 have been in long-term care, 61 have been residential. Asian also has 2, which deaths that have occurred, which is 1.37%. We have successfully shuttered our homeless triage tenting on our quick response to making sure that our vulnerable homeless population is taken care of. We hope we don't have to reopen it, but if we have to, we're ready to go. We're transitioning to the homeless care providers. We continue with our seniors on the food deliveries and getting them face coverings and masks. And it was great Friday. They're very appreciative. They did a big car parade by the Ray Jordan Senior Center to say thank you for everything the city is doing, and to the senior elder affairs staff, Sandy Federico and crew, and Helen Carlton-Harris, which I deeply appreciate. I think I'm going to be out there sometime in early July for another thank you and some swag stuff for them. Libraries, as you know, have opened up. All branches have opened up successfully. Curbside pickup in all branches, that is started. On the police side, Commissioner Clapper indicates to me they're down 3. very happy and thankful. Peaceful protests over the weekend were fine. Unfortunately, and to the individual that passed, there was a murder this weekend. It has been determined it is a drug and gang related, but I'm sorry for that loss. Police continue to investigate that. Fire Department, Commissioner Calvi, they are down, they're good, nobody really down, and they've started, as he said last week, they've started their inspections for smoke detector inspections, nursing homes, and just daycares when they start to get open. Facilities management in parks, Pat Sullivan, again, phase 2 is going very, very well. I do speak to the constituents who have come here to City Hall, whether they're waiting outside on their appointment or they're inside City Hall, and they're very pleased. I know departments are very pleased with it, so that's working well. The golf courses are working out fine. DPW, Chris Signoli is down 1. The alfresco outdoor dining, and I know Captain Hook, Doug Hook, that's near and dear to your heart, is going very, very well. A lot of other establishments have opened outdoors. Some have now put more applications to open outdoors. So the whole team that's been involved in that, from the legal aspects of Solicitor Ed Pacula, Licensing Director Alicia Days, DPW Chris Signoli, Pat Sullivan, Tim Sheehan, Commissioner Clapper, Commissioner Calvi, everyone involved. It's been well received, and that's going very, very well. And we want to get our restaurants back on track. On the finances, TJ, again, we unveiled the FY21 budget, and that has gone to the City Council, 6th year in a row that they've been able to balance the budget without any use of reserves, even with all these challenges, being able to keep a healthy reserve, being able to keep a strong bond rating, and being able to move strategically on key investments, and also in a compassionate fashion. So we await to work with the City Council on that. Superintendent Warwick indicates to me nearly 70,000 meals were given out Friday to our students and families. We are now approaching we're almost approaching 1.2 million meals totally given out. We are going to continue this throughout the summer and months to make sure our students and families receive their meals. Virtual graduations are done. Principals continue their graduation efforts, whether it's car parade or outside for photos. $18 million, Superintendent Warwick will update you, $18 million in scholarships garnered by our students. About 67% are going to college. Here's an interesting statistic. Most urban centers on this remote learning participation rate is 30 to 40%. Here in Springfield, 75%. And you compare that to affluent areas such as North Andover, which is 90%. That's quite a testament. That's why it was so important that we had established getting those laptops. We're already out and getting out another 10,000, 17,000 total on the laptops and the outreach of our teachers. The Oasis Food Pantry continues at Central High School on Fridays. 3,500 families are being helped there, and we work with Sedesco also on that. And I wanted to also bring up that on the Echo Dev with Tim Sheehan, just done a tremendous job. We announced Friday with Congressman Neal $2 million through HUD to help out our residents. We've been helping out our business community, but I wanted to help out our residents. We're using Wayfinders, Peter Gagliardi, as the conduit. That's $2 million. That's going to help out those residents in need to pay their mortgages, their rents, and their utilities. Peter Gagliardi thinks that we possibly could help out 1,000 families that qualify under this program, and I think that's extremely important. Director Shee and I were working on the third phase of Prime the Pump, which will be another $500,000. This will go toward businesses that have still been unable to open up and getting them what they need strategically to get back open. So we're hopeful that comes about within the next week to 10 days. That's extremely important. We also had Congressman Neal, who comes on weekly, Friday, and we spoke with the congressman, with our cabinet heads, my cabinet heads early Friday morning on our continued needs, and he does feel that fourth stream of money is going to come hopefully sometime in the summer, hopefully not as late as the late summer, but to help out state and local governments to be able to plug those holes pertaining to the COVID-19 coronavirus. We also spoke to him, Commissioner Clapprood and I, and Commissioner Helen Carlton Harris, on the police reform legislation. And I know they're looking to do the list, federal list on a bad cop or a cop that's been fired, but we spoke specifically on funding. You know, we need and want more funding for education and training. We've had a very successful C3 policing. There's going to be a community policing component. We want that also. And I'd like to see, as Commissioner Clapwood has indicated, what can I take off our police department's plate? Whether it's mental health funding, Commissioner Helen Carlton Harris, we had indicated, is there more preventative intervention money with some social service agencies, things that we can take off the list of the police department. If they are needed, obviously they will respond. So we continue to have a coordinated approach. On mental health, Commissioner Clapwood already does do with Behavioral Health Network, and many times they want police to respond. So in turn, we are moving in the right direction. I'm going to, matter of fact, tonight I will have a community roundtable with black leaders across the city. Many have been invited, and many will attend. Some said that they won't attend, and that continues my outreach pertaining to continuing to enhance and improve race relations and police relations. I did have a very good meeting, about a 3-hour meeting with my internal interdepartment, the cabinet heads and department heads, black leadership on that. That was very good. We continue to do the prayer vigils, one that I hosted. Commissioner Clapper and I were at Bishop Rosansky's prayer vigil this past Friday. And I've had a number of private discussions that have been very, very beneficial. So I look forward to hearing the thoughts, the ideas, and the constructive criticism tonight on this issue as we move forward. And then don't be surprised sometime this week when I'll make some major announcements on action steps that will be taken. But I continue to want to engage and listen, and I will continue to do that. And I see different perspectives at that time, and I think that's important as we continue to heal and continue to deal with this sensitive issue in a mutual, respectful way. So I think we have hit all the cabinet heads and the department heads updates. And again, you could see and I think when Helen gets up, she'll show you some great bar graphs. So we are moving in the right direction. And again, I thank the residents and the business community of the city of Springfield. You've been fantastic. We've told you to do many things. We continue to tell you to do many things. But you could see it's paying dividends, whether from Governor Baker on down to Springfield. You are not seeing the spikes that are occurring in other parts of the country, many states. And now some of those states are looking to shutter again. We don't want to do that. And in the meantime, we worked very closely with Dr. Kerouac and Dr. Roos. If and when there is a spike, they will be able to handle it with hospitalization. But we don't want to get to that point in time. So with that, I'm going to bring up the President and CEO of Baystate Health Systems, Dr. Mark Kerouac, and I deeply appreciate his efforts. His whole team, Baystate Health Systems, have been tremendous on the front lines. Dr. Mark Kerouac.
Well, good morning, everybody. I'll give you my Phase 2 look today.
He took the mask off.
So, I'm 6 feet away, right?
I know.
Yeah. Mr. Mayor, thank you for your leadership, and appreciate working with your entire team as well, the commissioners. It's been terrific, and I think the city's got a lot to be proud of in terms of how things have been dealt with. At Baystate Health, we're still dealing with three crises. One, the pandemic that I've talked about many times before. The other, the recession. The economic effects of the shutdown are becoming apparent. And finally, we are reckoning as a society with the issue of systemic racism, which has caused a lot of introspection in our organization. Let me take them one at a time. As far as COVID-19, as the mayor said, we are seeing a continued decline. This morning we had 25 patients in the hospital across the system, only 5 in the ICU. Compare that to early April when we had 180 cases with 40 in the ICU. We're testing about 300 people a day, and the test positivity rate has come down to only 2%. So not a lot of cases out there, but the virus is still circulating in the community. So I want to congratulate all the citizens of Western Mass that what you're doing is working. There have been no magic bullets coming from any healthcare providers. It's really been the hard work of social distancing, masking, disinfection, hand washing. Both in Massachusetts as well as some of the early states like New York and New Jersey, case rates are coming down steadily. So this is all to the good. On the other hand, as the mayor mentioned, in over a dozen states across the country, case rates in the hospitals are going up by more than 10%. Particularly some of the Sun Belt states like Arizona, Texas, and Florida, large population states that may have rushed their reopening a little faster. Oregon, for one, has actually gone backwards. They've had to call a timeout and move back to a previous stage. It's worth keeping in mind that in this country alone, there are 20,000 new cases every day and 800 new deaths every day related to coronavirus. The world total is 8 million, close to 8 million, with hotspots occurring in Africa, South America, and India. So the virus is not done with us yet. We have fortunately been able to keep a lid on it here, but there is nowhere near enough herd immunity, as we call it, to protect the people of Western Mass from someone either who's got the virus in our own backyard or someone who gets on a plane from one of those states or one of those countries to come for a visit to start another little nidus of infection that we would then need to deal with. So the message, again, like it is every time I stand up here, is please keep following the guidance. We've gotten away with being able to open things up a bit more. I noticed that City Hall is open. That was a good sign to see. Happy to see some of my favorite restaurants are now open for outdoor dining. But please follow the rules that they have set up. Keep wearing your masks, washing your hands, etc., and so we can prevent a reintroduction of this virus. Baystate Health itself has entered a Phase 2. Today we're going to be welcoming back visitors to the hospital on a limited basis. 1 visitor per patient between the hours of noon and 8, with the exception of patients infected with COVID-19. The details of that are going to be posted on our website. Going to the doctor is going to seem different, just like going to the restaurant or going to City Hall. There'll be masking, there'll be temperature checking, disinfection, etc. All of this to make it safe for you to do some of these important activities again. And so we've worked very hard to have a consistent look and feel for protecting you, the general public, so that you can feel comfortable going back to see your doctor for regular care. And that's an important thing to do, too, because all those other diseases have not taken a vacation while COVID-19 has been circulating. Moving on to the economic issues, as you all know, we're seeing record numbers of jobless claims, the highest since the Great Depression of the 1930s. And this virus and the shutdown it's caused has really blown a hole in the budgets of many areas. I know that many of the municipalities and states are hurting, and many businesses as well. I wanted to give you a quick picture of what's going on at Baystate Health. Baystate employs 12,000 people. We have annual revenues of $2.4 billion, and the economic impact on the greater Western Mass region is $4.2 billion each year. The cash flows to keep such a large organization running are absolutely staggering. It costs $6 million a day to keep the wheels turning at Baystate Health. And of course, when we stopped all elective surgeries and procedures back on March 17th, that put the budget into a free fall. Across the state, it's estimated that the Massachusetts hospitals are going to lose $1.4 billion a month during this slowdown in activities. We haven't really shut down, we simply slowed down. And the total impact may be $5 billion. For Baystate itself, the impact is between 150 to 200 million, we estimate, for the sum total of the impact of the virus. And happily, we have been able to, through the advocacy of Congressman Neal and the help of our state delegation, we've gotten about $100 million in relief payments. So still at least $50 million short, which we would need to take from our reserves. In order to get this financial situation under control, we've done many of the usual things that hospitals do. We've frozen capital spending, frozen hiring, frozen travel and meetings, and reduced executive salaries. We're asking individual areas to staff to volume. That is to say, if they have far less volume than they're used to, that they would furlough people selectively. I don't have absolute numbers of people who would be subject to this, and we're continuing to tailor it or customize it to the actual needs, but there will be some folks who are going to be furloughed on a temporary basis with benefits, hopefully to be recalled when the volume returns. The big worry to me is, what is the long-term picture look like? Most of my fellow CEOs I talk to across America say that they don't expect volume to be more than 80 to 85% of what it used to be in the coming year, partly because folks may be used to getting things through telehealth or other ways, partly because they may have decided to defer care or may be afraid to come to the hospital. In any event, we are going to have to adjust the footprint of our delivery system to the demand that the public shows, and so we'll be continuing to watch that. Finally, let me touch on the issue of systemic racism, which has roiled many cities across our country and really been quite upsetting and unsettling to so many of us. Systemic racism has public health aspects as well. And we have published on this in terms of talking about healthcare disparities between whites and people who are African American, Latino, or other as far back as 2014 through our sponsorship of the Public Health Institute of Western Massachusetts. One stark statistic to keep in mind that I kind of keep in top of mind is that in some neighborhoods of Springfield, neighborhoods of color, average life expectancy at birth is somewhere around 70 versus suburban towns where it's over 80. So that's a huge difference, related in part to disease burdens such as diabetes and high blood pressure, higher rates of maternal mortality, as well as deaths from violence. So these are all things that shorten the lifespan of communities of color that are among us. We've attempted to address this through our accountable care organization work and partnering with social service agencies around social determinants of health. This is for 40,000 residents of Springfield, working with experts in housing, nutrition, transportation, et cetera. And also, I think when social upheaval like this happens, it's important to take a look in the mirror. And as we've done that, there are certain things we're proud of and certain things we see as opportunities. We are working hard to deal with the disparities we see, but medical care alone is not going to reverse that situation. It's important as a large employer to provide economic opportunity through hiring, educational programs, as well as advancement. And all of these are areas where we have been active and again are examining what are we doing, how well are we doing it, and could we do more. I firmly believe that Baystate's mission of improving the health of the people in our communities every day with quality and compassion cannot be met unless we actually address the public health aspects of systemic racism, and it's something that we are determined to do and continue to do. A couple of quick announcements before I turn the podium over to Dr. Roos. The first is both Mercy and Baystate are going to be sponsoring a Zoom meeting on religion and culture and its impact to COVID-19 this Thursday, the 25th, from 2 to 3:30. It'll feature Dr. Sarah Perez McAdoo, one of our physicians, as well as Pastor Eli Serrano of the Restoration Worship Center here in Springfield. The featured speaker will be Dr. William Glover, who's senior pastor of Mount Hermon Ministries from Fort Myers, Florida, looking at the impact of COVID-19 and how this is seen through the lens of religion. Finally, I wanted to point out that this Wednesday, June the 17th, is Census Action Day. This is the 2020 census, and it's extremely important that the people of Western Mass be counted, because that count is going to determine a lot of the help we get from the federal government in support of the social programs to address so many of the issues we talked about today. It's easy to fill out the census either online, by phone, or in person, and I would encourage everybody to take it seriously and make sure we all get counted. So with that, I thank you, and I'll be happy to answer questions after Dr. Roos.
Thank you, Dr. Kerouac. And I want to also thank Dr. Kerouac. When I spoke about Governor Baker, the reopening, Dr. Kerouac was one of the individuals the Lieutenant Governor leaned on and gave the balanced perspective of not only on the medical health and sciences, but how to balance it to get businesses open. So Dr. Kerouac, thank you very much on that. Also, our sign language interpreters unfortunately could not make it today. We're hopeful that we have them back next week. Dr. Kerouac mentioned about the census. I was on a conference call with the New York Northeast region this past week with Gladys Oyola and the rest of the team on making sure that we continue to pursue the census, even with the challenges of COVID-19 coronavirus, to make sure that we are all counted. And it's extremely important because for funding aspects for the city of Springfield from federal down, and also congressional representation. So we're also meeting on that. So with that, again, very happy to have Dr. Robert Roos, who's the Chief Medical Officer for Mercy Trinity Healthcare, and he's been a great partner, as with Dr. Kerouac. Dr. Robert Roos.
So thank you, Mayor, and good morning to everyone. And Dr. Kerouac, I'm going to join you in our Phase 2 unveiling this morning. One of the most notable and positive aspects, I think, of our response to this pandemic has been the fact that we've been in lockstep all along the way as healthcare institutions right here with you and the community. And as long as we're keeping our appropriate distance, we'll continue to be cautious, and I know we'll move forward together. So I want to thank all the commissioners for their continued work during these challenging times, and to you as the media for continuing to report on these important matters. I hope you all had a nice weekend. It was a beautiful one, and it's impossible not to recognize the fact that there's been an increase in activity over the past few weeks. Of everybody out and about. I live up in South Hadley, close to the Connecticut River, and the number of people going back and forth and getting out on boats is a sight to see right now. And we've seen people engage in outdoor dining and the like. And going outside and getting some fresh air, so to speak, is clearly something that's good for us in body, good for us in mind, and good for us in spirit. And I must admit, after 3, what seems like long months, where we all sort of collectively were holding our breath, staying inside and almost exclusively at home, it does now feel like we're collectively starting to inhale a little bit more deeply as we reopen our communities together. I use that analogy purposefully this morning, and I want to make clear also that while we've flattened the curve and reduced the rate of transmission tremendously, we aren't yet at a point where we can exhale completely and take that sigh of relief. We heard both the mayor and Dr. Kerouac talk about the experiences of some of the other communities and states around the country. And in my view as well, it's too soon to relax completely, right? Until we have a vaccine and we know that that's safe and widely available, we must remain vigilant and monitor the science and the data on a daily basis. There are 22 states right now across the country that are seeing an increase in the number of cases reported with COVID-19. And we know that this is not only a result of more testing, that there are increases in the percentage of positive tests, and there are increases in the number of hospitalizations in some cities and states across the country. And in some places, there are questions being raised about whether or not they should return to a prior state of lockdown. And as the mayor said, taking one step forward and then two steps back would be too detrimental. So I must urge us all to not move too quickly, to not disregard the guidance that has gotten us this far, that we must continue to protect our lungs and we must continue to protect each other from transmission of coronavirus by doing the things that we know are successful, by wearing the masks in public places, by continuing to stay home if you're sick, and by practicing the physical distancing. Locally here, we've continued to see positive signs, particularly in tracking those two important elements of the percentage of positive tests and the numbers of hospitalized patients. At Mercy Medical Center, we currently have 8 confirmed COVID patients, with only 1 in our intensive care unit. We've now had less than 10 patients in our hospital with COVID for 2 weeks running, and we've had 12 consecutive weeks of declines overall in both the numbers and the percentage of COVID patients in the hospital. In regards to testing, we've tested now 14,198, with 2,664 positive and 11,422 negative. The percentage of positive tests has also consistently declined over the last 12 weeks, and now we're seeing the percentage between 2 and 5% on a daily basis, down significantly from our high of over 40%. And in fact, we're only seeing a small number, a handful or less, of positive patients at Mercy Medical Center every day. In this past week, we had our first day with 0 positive tests. And so while we remain cautious and vigilant in terms of our community, one of the areas that we know we must continue to progress in is healthcare. Where in healthcare and hospitals, we have safety protocols in place, we have our PPE on our personnel, and we know that delaying care has significant implications. So as of today, Mercy Medical Center is also joining other hospitals in its attestation to enter phase 2, where we now are able to offer elective, non-essential procedures, services, and office visits, including all types of surgeries except purely elective cosmetic procedures. We're also offering screening studies and office visits, which means that you do not need to delay those important tests like colonoscopies or mammograms any longer. You do not need to delay those important office visits like for diabetes or high blood pressure or asthma. And this is really important because across the country and across the globe, we've seen the impact of delaying and deferring these important disease management and preventive efforts. It's been stated by the American Academy of Pediatrics that we've seen a decline in immunizations for things like measles and other vaccine-preventable illnesses by as many as 30 to 50%. And right now, we know that there are outbreaks occurring across the globe There is diphtheria being seen in countries, and cholera as well. In 18 countries that had suspended some measles vaccination programs are now reporting outbreaks of measles. These outbreaks have the potential to create pandemics of their own if we don't quickly address them. And we certainly don't want addressing the COVID pandemic to lead to others here in the United States. So I urge you to continue with that preventive care and reach out to your pediatrician if your child needs a vaccination, or are you concerned that they may be ill and would need some care. The same type of outcomes could happen if we delay things like cancer screening, where delaying tests could lead to delays in diagnosis or a lack of diagnosis entirely. Your health is our priority, and we are here for you, so please do not delay that care. As we've talked about before, the care can be delivered in different ways, and right now that care can be delivered in the office under the Phase 2 guidelines, or you could see your primary care provider, your specialist, or your surgeon through the comfort of your own home using telemedicine, an audio or video visit using an app like through your iPhone. In fact, right now, more than 2/3 of our visits in the Trinity Health Medical Group are occurring through telemedicine. And as a patient or a family member, you can request that visit right now by calling your office or by going online at www.trinityhealthofne.org/virtual, and you can get an appointment within one day. So whether you're concerned about COVID or you're not, it's a great way to see your provider, and it's another way that we can provide safe care to you. We are continuing to test all patients coming for procedures and all patients coming into the hospital. We've also begun offering antibody tests to staff on a voluntary basis, and we will be working with many of you as employers, as schools and universities, as you look to reopen your businesses or your educations of higher learning in the fall, as we know that testing, surveillance, and contact tracing is key to ensure the safety of our community. And lastly, I also want to recognize that these have been challenging times for our frontline colleagues, challenging times for our patients, and challenging times for families, particularly as because of the restrictions that have been in place, individuals that have been admitted to the hospital have often had to do so without the accompaniment of loved ones or family members. So today, in alignment with DPH guidance, Mercy is also beginning to allow one visitor for hospitalized or surgical patients after passing a screening and while wearing a mask in the facility. At this point, our change in our visitor policy does not include the emergency department. It does not include our ambulatory areas, including the cancer center or our endoscopy suites, because there's certain areas there's increased risk because there are immunocompromised patients, as well as there are additional challenges in ensuring that we can maintain social distancing. So we'll expect to move those restrictions in future weeks or months as we continue to progress with the pandemic. And now, as we continue in Phase 2, just let us be reminded that this is going to be a long road, that there's going to be twists and turns and challenges. And recently, the Centers for Disease Control and Prevention published 2 sets of guidelines regarding what we should consider as individuals when we go out and how we should evaluate different events and gatherings. I suggest that you all review them at www.cdc.gov. They're important because we must continue to follow these guidelines, and what we do today will impact what we can all do next week, the week after, and going forward. So I want you to know Mercy Medical Center and Trinity Health remain prepared, ready, and committed to provide care for you safely, equitably, often from the comfort of your own home, and with great concern for your health. We continue to urge you and thank you for the great work you've done and for continuing to take care of yourself and others. If we do that, I am certain that we will emerge stronger from this together. Thank you.
Thank you, Dr. Roos. I'm now going to open it up for questions for Dr. Kerouac and Dr. Roos so they can get back to their duties. Dr. Kerouac? Dr. Roos, any questions from the media of Dr. Kerouac, Dr. Roos? Paul Tuthill, please.
I know it's only been a week since the elective procedures have been allowed, but have you had success in convincing people to come back
I think that for some of the routine screening procedures, like colonoscopy and mammography, those have been lagging. For people who've been waiting for some elective procedure, that's been much easier because, let's say a joint replacement surgery, they're lining up because they're anxious and they're symptomatic. But for something that's pure health maintenance, that's been lagging.
What do you say to people, and what do you say to people who may be sitting out there wondering, I mean, there's enough excuses for putting off some of this stuff.
Right.
Things like that.
Sure.
What do you say to people who now have another reason not to do it?
Well, I guess it's, the same messages we've been trying to say to them before, and that is that some of these cancers are very preventable if they can be screened and detected. But in spite of bending over backwards to get people to come in, we still, in a good year, convince maybe 80 to 85% of people. And so now we've kind of fallen back a bit and have got to work our way back up, but it's just continued re-education.
Dr. Russo?
If you have any new ideas, I'd love to hear them.
No, I would emphasize the same.
Yeah.
We certainly are seeing both patients and providers eager to provide care, and we are continuing to reiterate the message that we have safe protocols in place for everyone, that the care is important, that certainly delaying it can lead to negative outcomes. And now we have significant evidence that can suggest that, particularly in the area of things like vaccinations or not receiving care for chronic illnesses. And so those messages just continue as we want to support the health of everybody.
Any other questions of Dr. Kerouac, Dr. Roos?
So you alluded to some national projections for what you expect volume-wise. Is that what you're going on in Baystate? Do you expect it to be the same as what the national projections?
Yeah, I think everyone is sort of guessing at these things, right? And so the majority of the guesses that I hear is in the 80 to 85% range. And I tend to suspect that some people who are getting their care in other ways, or maybe have neglected care and somehow gotten away with it, at least in the short run, or are just plain scared to come to the hospital, may depress things to some extent. But nobody really knows for sure.
Dr. Roos?
I think when we look at the projections, it's going to vary a bit on the type of care that we're talking about. And so I think there's models that will look at the percentage of people that will return to emergency departments, for instance, and we may see that remain only at 80 or 85% of prior volume. But there are other ways in which we deliver care for other types of conditions, particularly those that are amenable to telehealth. We've actually seen in some of our in-home therapy or behavioral health programs an uptick in utilization and efficiency because of the fact that now telemedicine is so widely applicable. So I want to reinforce that continuing to use those methods for those areas in which it's clinically appropriate and feasible, and making sure that we advocate for have the financial and federal support for continuing telemedicine where it's appropriate can help us reach even more patients, and particularly earlier in their disease.
Any other questions from the media?
This gentleman over.
I was curious, you mentioned that, when Dr. Carroll mentioned specifically with our Baystate, but so just like you remind you that there is a concern about the decline in use, and you kind of mentioned that there's maybe some people pulling back on ER use, and that's been talked for years about how that's both more expensive and not necessarily any better. Do you think there, for lack of a better description, there may be an opportunity to try to get people away from that kind of care and yet still not, bankrupt your financial model for your hospitals?
Yeah, we are actually looking at that. One of the interesting things that happened in this pandemic is because of the reluctance of people to come to seek regular care, we've had to sort of jump into the telehealth stuff. So for example, before the pandemic, we may have had 20% of our doctors who are able to participate in telehealth doing it, and now it's over 90%. At the height of the pandemic, over 60% of the visits were done in a virtual fashion, either phone or video. And I think that both patients and doctors have found out that for simple stuff, this works actually quite well and it's much more convenient. And so we would love to see those kinds of visits for simple routine things replace a visit to the emergency room or even to the doctor's office.
Concur. No, I think I would concur completely, and we will continue to transform how we operate as a hospital that will meet those needs of the patients. So if it's better served in those ways, we will be there for them.
And before you mentioned the number 300 tests, what's the time period? Was that a day or was that
Every day.
a day? And are you, one of the things that you see the numbers that come in from the state, and they do break down positive cases by county, but they don't break down the actual testing by county. Are you confident in the amount of testing that's actually happening in Western Massachusetts to monitor the disease as opposed to just the overall state picture?
I think that the state in general would like to test more, and so would I. The state's testing roughly 10,000 people a day. They'd like to test 45,000 by the summer and 75,000 a day by December, which is quite ambitious. We have the capacity to do 1,000 tests a day, but we're only doing 300. And so just last week, we lowered the criteria so that even asymptomatic people can come to be tested. And so I think as we make it easier and easier to get a test, then we'll do more testing, which provides even more control. The other thing we've transitioned away from is that long, skinny swab that goes through the back of your nose to the back of your throat, the so-called nasopharyngeal swab, to a self-administered nasal swab, which only goes in about an inch or so, and the patient puts it in themselves. Much more comfortable, much less need to be totally geared up on the part of the hospital personnel, and much faster. So if we make it easier and less difficult to get a test, I think we'll do more testing, and that will enable us to sort of jump on these little brush fires sooner. We're also seeing a lot of requests from people interested in reopening, the colleges and the universities, the daycares, various businesses who want to test everybody in the joint to make sure there are no positives in the whole group. And so we're trying to assess to what extent we can be helpful for what could be a real upsurge in testing related to the reopening.
Dr. Bruce, you mentioned that there was a day we had 0 cases. Was that people, you're starting with really admitted, you don't mean like all people that person tested, right? And what's your average daily testing that Mercy's performing across the board?
So in that particular case, I was referring to all the tests of patients coming through the Mercy Medical Center testing, which does include folks admitted, but it also includes the pre-procedure folks as well as our emergency department in that particular instance. We are testing about 500 in-house per day on our platforms, and that is as a result of Life Laboratories has a number of different arrangements with other facilities and other providers who are doing testing. And so for our in-house capacity, I could see us continuing to want to expand that to be able to allow to have more testing done in the facility. If we exceed that, then those tests go out to other laboratories and we get those results back within a couple days.
Any other questions at all? Immediate? Dr. Kerouac, Dr. Roos, thank you for taking the time to be here. Thank you for what you and your teams are continuing to do for us. We're going to now move to the city updates from my cabinet heads. And again, we are living in surreal, extraordinary times. They have done a tremendous job all the way down to rank and file, and I deeply appreciate it. We've been tested and true through a number of natural man-made disasters, but you can't say thank you enough, and I want to thank each and every one of them and the rank and file of the city, too. So with that, I will bring up the Commissioner of Health and Human Services, Helen Carlton-Harris, who has been the point person for this continued effort to defeat, which we will, COVID-19 and coronavirus. So Commissioner Helen Carlton-Harris.
Thank you, Mayor. I am extremely appreciative of your support and having conversations that are meaningful and important. So thank you. The City of Springfield, I'm going to move over to the bar graph. The first bar graph is really what the mayor has referenced when he talked about the cases in the city of Springfield, 2,537. But what you can see in the city of Springfield is the flattening of the curve. You can see the beginning of our numbers and, as the mayor indicated, where we are right now. The mayor has said congratulations to the residents of the city of Springfield and the Western region as well. We are appreciative of everything that everyone is doing to flatten this curve. It was done through a lot of hard work and sacrifice, and we are extremely appreciative. Another graph I'm going to show you is the deaths in the city of Springfield by age. And I'm grateful to Jason Mann of the Economic Development Department, who is our GIS manager, who is very helpful to me as I work with these graphs. The graph that represents the date, the deaths, is broken out, as you can see, by age. 40 to 49 were 4 deaths, 50 to 59, 7, 60 to 69, 20, 70 to 79, 32, 80 to 89, 32, 20 and 90 to 99. This data was derived from the burial certificates that we get in the Department of Health and Human Services. We use that to break this out by age. And this really does represent a cross-section of the deaths that we've seen in the city. And I think it's important to recognize that there are individuals, 40 to 49, who have died from COVID-19, and in the 50 to 59-year-old age category, as well as in the 60 to 69. So it's important to recognize that across the city, we have experienced deaths that families are dealing with. Each one of this 115 represents a family. It represents a gap in a family tree, and it represents heartbreak and heartache. And so, as the mayor always says, our hearts go out to all of the individuals who have perished as a result of COVID-19. We are currently dealing with twin pandemics in our nation right now. One is the pandemic of COVID-19. The other pandemic is related to race, racial inequities, and racial disparities. The consequences of living where there are racial inequities based on race has an impact on the health outcomes of Black Americans, represented in higher rates of infant mortality, heart disease, stroke, incarceration, premature mortality, and reflected in our poverty rates. It is important that we understand this is not a reflection of genetics. We have to understand there are targets of oppression and there are agents of oppression. In my work in public health, it is important for us to understand that public health, and I've said this many times, is a social justice movement rooted in science. And social justice contends that socioeconomic status, racism, and classism are barriers to societal benefits. It's also important that we understand that science is the data we use to develop evidence-based strategies to combat health disparities and health outcomes, including racial inequities. It's important in our two pandemics to understand that there are commonalities Both require examining our values. Both require behavior change. Both require uncomfortable conversations. And both require structural and systemic change. Both require talking about the social determinants of health, reducing poverty, workforce development, access to quality education, safe and decent housing, systems of care that are easily navigated, and feeling safe in a living environment. Public health. The science of prevention and intervention is important with COVID-19, but it is important also as we look at issues related to race and social justice. Uncomfortable conversations. Patrick Sullivan does not know I was going to do this, but on Friday, Patrick Sullivan and I had our beginning uncomfortable conversation. Although we've known each other for a number of years and we've worked together for a number of years, on Friday, we started off by talking about our grandmothers and how they have similar values and how they raised their children and their families. But then we talked about the journey to America, and it was very different. And so Patrick could talk about an Ellis Island experience. I can talk about an experience where people were tied to planks and were in holes as they came to this country not by choice. And so we talked about the journey, and then we talked about the outcome. Where are your ancestors now as far as this nation is concerned, and where are mine? Uncomfortable conversations, but at the end, we said to each other, he said to me, I hope I never offended you and your ancestors, and I was able to say, you did not, but we will continue our conversation, uncomfortable conversations that are necessary. COVID-19, uncomfortable conversation. Our way of life has changed. Wearing face coverings is going to continue. That will not change for a while. Social distancing will continue. Hand hygiene will continue. Our lives have changed, and we need to acknowledge that in order for us to be able to continue to not go those 2 steps back, we have to continue to do the non-pharmaceutical interventions that I just mentioned. 2 pandemics going on at the same time. If we want to be a nation that defeats these 2 pandemics, it's important that we come together and have uncomfortable conversations, but also practice the areas and the non-pharmaceutical interventions that we know are working. I am extremely appreciative of the work that is being done by the city, by the conversations we're having. The mayor mentioned he had a 3-hour, perhaps at times, uncomfortable conversation with the Black leadership in the city of Springfield. He can talk about that because it was our experience together. But it's important that just as we take COVID-19 serious, we take and understand that each one of us want to live in a country where we are valued and not judged based on where we live, what our zip code is, the color of our skin, and those prejudices that we know happen. You know, I have to tell you, and I know my heart is just so full of what I've seen across this country, particularly again this weekend when we saw another individual, Black man, lose his life. And I have to tell you, having been raised by a police officer, police lieutenant, my heart breaks for the family of that individual, because it feels to me that when someone gets shot in that way without regard for their life, it's very, very painful. I do apologize for becoming somewhat emotional, but for me, these are emotional times with COVID-19 and the twin pandemics of COVID-19 and racial inequities. Thank you.
Thank you, Helen, very much. Thank you, Helen, on the update and also your heartfelt words. It has been a very difficult time for Black Americans or Black Americans here in the city of Springfield. It's challenging. It's been a sensitive time. It's been eye-opening in the conversations that I've had. For many, it opens up wounds of the past and the present. So the dialogue is extremely important, to listen, which I have been doing and will continue to do, and to work together as one in a mutually respectful way for solutions. And that's how we move forward. You know, with history, you can't rewrite history, but you can obviously learn from history and use it for the betterment of the present and the future. And that's what we're going to continue to do here in the city of Springfield, dealing with this overall situation. We've made great strides. There's more that we need to do, and we will do that. And again, I look forward to another community conversation this evening, and stay tuned. I'll be making some announcements, action steps this week as we move forward, not only on defeating COVID-19 and coronavirus, but as we move forward on continuing to enhance and betterment of race relations and police relations moving forward. That's the true way to honor the legacy of Mr. George Floyd. That legacy is of hope and concrete change. But a lot of discussions have been held, some in private nature, and sometimes you think that you might have a handle completely on everything. But then you learn something new every day, and what could be eye-opening, whether it's on a national, state, or local level. So we'll continue to work together, and we'll continue to move the city of Springfield forward. With that, I'm going to go into the public safety component, and I will bring up first Commissioner Bernard B.J. Calvi, the fire department. They continue to be out there day in and day out, and are doing a fantastic job under his leadership. Commissioner B.J. Calvi.
Good morning. Thank you, Mayor. Today I'd like to report that we have no firefighters out in regards to COVID-19 type illnesses. So we're at full staff. We've begun the process of catching back up on our smoke detector inspections. The smoke detector inspections were put in abeyance some 3 months ago for real estate sales and deed transfers. So this morning we began the process of trying to dig back out of the backlog of smoke detector inspections. The inspectors are also going to begin getting out to take care of our quarterly inspections with the nursing homes, the daycare centers, and inspections such as that. Also, we're still having somewhat of a problem with people shooting off illegal fireworks in the city. Just want to remind everybody these devices are very dangerous. They can be harmful to your health and the health of others, and in a community like this where we are densely populated, the falling brands and sparks can also start a fire that could be quite severe. So if you're shooting off illegal fireworks, just a reminder, please do not do it. You could harm yourself or harm another person with these. That's all I've got for this week. Thank you very much.
Thank you, Commissioner Calvi. Yeah, please heed Commissioner Calvi's advice on fireworks. I know this is occurring in my neighborhood, though it has gotten better, and I want to thank Police Commissioner Cheryl Clapperwood. She has put details out there, and recently at least a half a dozen confiscations and fines or activities were curtailed. I know those units continue to go on. It has been a phenomena across the country with the fireworks, and some of it's heavy artillery. Again, 311 is for tracking purposes. If it's after hours, it's tracking. If it's during, after those hours, 787-6302, the non-emergency line. So that way on police, the units can take a look at that depending on what other emergencies that they're dealing with. But I commend Commissioner Clapperwood. She has put a unit out there, and I have heard from some people that it has gotten better, but we still are going to be vigilant. But as Commissioner Calvi indicated, you know, you could possibly start a fire. It is extremely dry out there, and we don't want that to happen. But I know in other locales across the country, their fireworks complaints have skyrocketed by 200%. 200%. So listen, let's be respectful out there to your neighbors, to your neighborhood. You could be harming not only yourself and your family, but you could be harming your neighborhood. You don't want to see anybody get hurt. But there are units out there. I think late last week was reported about a half a dozen violations and confiscations occurred in areas where we received calls and we're tracking those. So that's extremely important. As with Fire Commissioner B.J. Calvi, Police Commissioner Cheryl Clapperwood has done an outstanding job in leading the Springfield Police Department during very trying and difficult times, not only with the COVID-19 and coronavirus, but with the current situation on dealing with race relations and police relations. It's a delicate balancing act about being respectful and also being able to provide safety to each and every one of our residents and business community, no matter what creed, color, and background. I know she has continued to have discussions with the minority representation on her police force. She continued to have discussions with me and other community members, minority or black community members here in the city. And we're going to be listening. And we're going to be continuing to work together and move forward on what we have done very, very well and look to see what we can do to enhance a better mutual understanding. So with that, I'll bring up the Springfield Police Commissioner, Cheryl Clapperwood.
Thank you, Mayor. We have 3 out officers, COVID-related. One is still awaiting some test results. One is quarantined, and one tested positive and is still out. We had a peaceful weekend. I'd like to thank everybody who participated in the protests this weekend. Everything was fine, no incidents. The march from Commerce to Court Square went about as well as could be. Everybody was very respectful on both sides. So the police department is also very grateful. I pulled up Saturday morning before I was going to check the Court Square area, and I saw some signs on our lobby window and in front, and at first my heart sank, and I said, oh, no, they got inside the police department and they put signs, but they were all in appreciation and support. And we stand by you, and these times are tough, but we appreciate what you do. And I have heard from so many officers this morning that they just appreciate being recognized and the work that they do and what they will continue to do on a daily basis. We did have, unfortunately, a homicide Saturday night. It is absolutely gang and drug related. We do have some video that's a gathering of 25 to 30 people. I believe it was a anniversary of another person's death that made them gather. It's very fluid. It's still under investigation. There's a lot of video to go through, but there was definitely more than one shooter, shots rang out in different directions. So I think we're very fortunate, Mr. Mayor, to have no other injuries, because there was a lot of people in that park, including some children. So that is under investigation. We will continue to look at that. Other than that, it was a nice weekend, and I look forward to working with the mayor tonight on the roundtable and further discussions. The police department is very willing to do its part to make sure things are going smoothly, and I thank the women and men of the Springfield Police Department for their continued support and their continued work ethic. Thank you.
Thank you, Commissioner. Thank you very much, Commissioner. We'll now get an update from DPW, Director Chris Signoli. Chris?
Mayor, thank you. With regard to DPW, we have one employee out, and it's starting a 2-week quarantine this week. Construction activities have continued to increase over the city. Our Central Street project will be starting within the next month out there. So that is another project. We probably have about 8 weeks left on the Six Corners project. We have been, my department and a lot of the other departments in the city have been working through the applications for outdoor dining. Those have gone very, very well. This week, again, we will keep an eye on our schedules for trash, recycling, and yard waste. Over the past couple of weeks, we've had issues over at the plant, so we wanted to, some of our pickups were delayed during the week. Tapley Street, that was opened a few weeks back, is continuing to operate by appointment only, and there have been no issues up at Tapley Street with regard to people getting appointments or getting in or getting permits processed through our department or through any of the other departments, building department, etc. So follow the appointment standards, and that is it for the DPW. Thank you.
Thank you, Director Signoli, and again to your team, especially the refuge, picking up the trash and recycling and yard waste. We really appreciate that. Paving is going well. That lower Belmont, Mill Street, Locust Street area came across very, very well. The lining occurred late last week or this weekend, and I know the roundabout is moving forward at Six Corners and other areas where we're doing that, and traffic lighting too. So appreciate that. On the school side, again, Superintendent Dan Warwick and his team have done a tremendous job in very challenging times, and I shared some of the updates he gave me early this morning. I'm sure he'll reiterate that and bring up some new things. He and his team are in the midst of working with DESE and the state, to get our kids back for the fall. So Superintendent Dan Warwick.
Thank you, Mayor. Just to begin with an update on our school meal program. We're now up to, as of this weekend, 1,178,660 meals that have been distributed since school closed. We're going to continue that meal distribution program through the summer. We're going to have all 17 sites up, and again, Central on Friday, so 18 sites. Just for this weekend, because on Fridays we distribute for the weekend, we did 69,632 meals. So our team at Central Office and Sodexo, our school lunch provider, my hat's off to them. They've absolutely been incredible during this crisis and have really helped throughout the city. Sodexo's always been there for us in times of crisis as a city, and they stepped up in a big way again, and I'm very, very proud of them. We're continuing. Our last day of school is going to be June 19th. We've been providing remote services since schools closed down on March 12th. During that time, we've reached out to every family. We've distributed 17,000 laptops, many hotspots, made sure we worked on internet connectivity for the families. And I've had all of our teachers, counselors, and administrators reaching out to families to try to get the participation rate as high as possible. You know, we've seen some studies through the state where the participation rates in some urban centers are very low. Ours was higher than we anticipated, and our participation rates looks to be around 75% as we speak, and we're still working at it. So again, better than most, but not where we want to be. But every family who hasn't participated, we've reached out 3, 4, 5, 6 times to families with different staff, encouraging and providing support for that participation. We're going to continue summer school. We're going to offer all the summer school offerings we always offer. Our course recovery at the high school level, which is so important, some of our remedial programs at some other levels. But in addition to that, we put extra money in for an enrichment program that will run all summer. We're going to keep our laptops out in the students' hands. And again, I thank the mayor and school committee for their support with our one-to-one laptop program, because there's no way we could have executed during this time without that support. And that was done about 5 years ago, without COVID in mind, but looking to use technology to improve instruction. But since then, it's been very helpful. And during that 5 years, we provided a lot of PD for our teachers on using the technology. And of course, that's really been very important during this process. So we're going to offer an enrichment program for all during the summer, again, to make up for that lost learning time, because the kids did lose 1/3 of the school year of traditional education, and we're working hard on that. We're doing our graduations. We've completed our virtual graduations. We did 8 virtual graduations for the last 2 weeks. In addition to that, and again, I commend my high school principals, they set up different graduation events at every school so that in a socially, using social distancing guidelines, they had some activities for our kids and families that certainly made them feel better about this rite of passage that is senior year and graduation. So I think the schools did a great job on that. We're also putting together some of our data for our graduating class. And as of right now, our graduating class has already secured $18 million in scholarships, and right now 67% of the students are reporting they're going to go on to college. We'll continue to work on that, of course, all summer. A question that constantly comes up is what's going to happen in the fall, and I will tell you right now, you know, we're watching the infection rate statewide, and the commissioner has a team at the state level that's taking a look, you know, and that team includes epidemiologists, and really taking a look at how best to reopen in the fall. There's a lot of talk about a hybrid model where percentages of the students would come in on like A and B days, and the rest of the students would be engaged remotely. So I believe that's how it's going to go in the fall, but we're a long way from executing that at this juncture, and I think that's probably going to depend on how the COVID-19 cases are falling across the state as we reopen. So we're going to continue to get information out on that. And at this point, like I say, what I'm giving you is purely speculative at this juncture. The commissioner is leading the effort at the state and has a significant team working with the unions, working with parents, and then working with educators to try to come up with a best way for us to reopen and reopen safely for our kids. So that's all I have for now. Thank you, Mayor.
Thank you, Superintendent Warren. Thanks, Dan. Again, I always say Springfield's in the business of doing business, and Chief Development Officer Tim Sheen and his team done a great job with the prime, the pump money that we put out there, the HUD money to help residents with mortgages, rents, and utilities through Wayfinders. And we're going to continue to do that. So without further ado, I'll bring up Chief Development Officer Tim Sheen. He'll give you an update. Tim?
Thank you, Mayor. As the mayor said, if you're in need of mortgage, rent, or utility assistance due to income loss as a result of COVID-19, please contact Wayfinders through the CARES HUD funding that we had received. We provided over $2 million worth of assistance for that type of housing stability. You can contact Wayfinders at 413-233-1500. The grants are available for households in the amount of up to $4,000 per household. As the mayor indicated, we remain focused on advancing a third round of Prime the Pump for reopening of small businesses. And we're looking for an appropriate assistance structure for the nonprofit community as well, as we recognize that they're a significant employer in the area. To date, the city has received $7.5 million in funding from the federal government. We have deployed approximately 5.5 of that since April 2nd. $1,250,000 has been advanced for small business assistance, $2 million for housing stabilization, $500,000 for food security, $250,000 for school planning in terms of the reopening logistical issues, $500,000 for recreation, $1 million for homelessness as well. And that's my update for this week. Thank you.
Thank you, Director Shane. Thanks, Tim. I gave you, again, the finance. The FY21 budget is now to the council, and we look forward to their review and due diligence, and look forward to continuing working with them. On the legal, HR, and labor, received those updates from Solicitor Pakula early this morning, and Attorney Bill Mahoney. Status quo on those situations, gentlemen. Eddie, status quo, just want to double check on that. So with that, I'm going to open it up to questions for my cabinet heads or myself, if there's any. Yes, huh? Oh, Pat, wait a minute, yeah. Wait a minute, how could I forget the Wizard of Oz? Helen, you always have his back. Pat Sullivan and his team done a wonderful job with facilities, with the parks, you name it, and thank you for jogging my memory. Pat Sullivan. Thanks, Helen.
Thank you, Mayor. And Helen, thank you for our conversation Friday. I look forward to continued conversations. We are continue to put plans together to try to open more recreational opportunities and buildings for the city. But as stated last week, due to the CDC guidelines and the Commonwealth's guidelines, it would be very difficult to open up our summer enrichment programs with 10 or less participants per group. So they will be closed, but we look forward to the school department. We've been talking with Dan Warwick. He's got great plans for enrichment programs this summer for the youth, so we will work with him to get those posted. Our golf courses remain open, and the good news is, working with our procurement office, we are going to be having an online way to get tee times, and hopefully within the next month that will be available to the public. Pools and 5 Mile Pond will be closed, again, due to the CDC guidelines. It would be difficult to operate those operations at a 40% reduced capacity. The splash pads will be open. We'll be working with HR this week to hire the 10 to 11 individuals we will need to sanitize them on a daily basis and to have the proper hand sanitizer stands available at those locations. Sports teams can now receive at our recreation office their guidelines and permit applications if they would like to hold practices, again, of 10 or less youth per group, and tennis matches were able to open up again on the tennis courts. Thank you.
Thanks, Pat. Sorry I missed you, Pat. Okay, again, deja vu all over again. With that, any questions that you might have of cabinet heads or myself? Paul? Sure. Director Sheen.
I don't have that off the top of my head. I know that there's been well over 40 that have come through the process, right, Chris, just about, in terms of have applied since we've announced it?
So 40 have applied?
Yes.
Sure.
Is there any thought about, we're seeing some other communities now that are adopting
Timothy, but on 4th Street, people are loving it there. And when I went to welcome and thank everybody coming down the other night, later in the evening, they loved it and, said, can this be looked at moving forward? I think through, Director Sheehan and Director Signoli and Helen and everybody else, where possibly, in public safety, where possibly might make sense, that obviously that be looked at. Others, I think it's stopgap for right now, and others are adjacent. I know with Leone's opening up, Max's Tavern, I know Frontera Grill, and we go on and on at the Streamline. So I'll let Tim finish up. But that one could be a possibility. You never know.
I mean, outdoor dining has always been an activated sense of place. So as much as we can encourage it, we would. We've had an outdoor dining ordinance, and we would look to try and expand that to suit as many businesses as we can. It certainly activates the streetscape, and it's a good quality of life issue.
Any other questions or comments? Okay. Go ahead, Paul. Yeah, sure.
For the superintendent,
Superintendent Warren?
I know you said a lot of things respectful to this, so what's going to happen when schools reopen in the fall. One thing that Jesse has advised local schools to do is to start securing PPE. Can you talk a little bit about how that process has gone for the Springfield schools?
Yeah, the mayor and his team have been tremendously supportive of that. So they've supported our efforts in securing the PPE we're going to need to open. We have a reopening administrative group looking at that, and we're already working with the city team to get the PPE we need to open. So we're confident we're going to have the PPE we need should there be a reopening in the fall.
So if you're looking to buy masks for staff and students and what else,
Cleaning supplies, masks, the nursing equipment is really extensive. But we're looking at all the recommendations from the CDC and from DESE, and they put out a list of exactly what we're going to need and what the burn rate on all the materials are going to be. So we've been working on the order with that support from DESE.
What's the impact on your budget?
Well, we're hoping to get some support from the city. The mayor's been very good with that, but whatever it costs, we're going to have to make sure our kids are safe, and we're going to build it in. We don't have fixed costs yet on everything, but there are going to be significant costs relative to the PPE and reopening, and we're going to figure out how to build that into our budget. Thanks.
We need the, on a federal level, a much better job has to be done on the federal level of making sure that the PPEs are, first of all, that you can get them, two, that they can be properly distributed. I shouldn't be competing with mayors across the Commonwealth. Governor Baker shouldn't be competing with governors across the United States of America. So this needs to continue to be a mobilization with our manufacturing base here in America, and I think it's extremely important. And we all hope we're wrong, but I'd already given the edict or the order. Keep stockpiling the PPEs, because you never know. We've learned a valuable lesson through this 100-year pandemic. So, one instance I'll give you, and Helen will tell you, and Pat, thermal infrared thermometers. Very, very difficult to get. But thanks to the goodness of the generosity of individuals, the business community, we've been able to get them. We have them on order. And even speaking with A.G. Moore-Healy, who calls me periodically, the price gouging that goes on. You wouldn't believe some of the price tags that were coming in early on when we were trying to secure PPEs. Absolutely ridiculous. And that's being pursued too. So the mobilization must continue to happen on the federal level. and then have that trickle down to the states and the locales. We also spoke with Chairman Neal, Congressman Neal Ritchie, on the fourth phase, this funding phase, which I would think COVID-19, coronavirus, obviously the PPEs will come into play as far as monies for the state and locales. And also what I would consider a rebuilding phase, the Congressman Neal spoke of, the infrastructure bill, which I know the President and Congress really wants to do, and that would be the rebuilding phase. But we still need that mobilization on the federal level, that there is a, let's say, convenient, I like to say easy, but convenient access to obtain these PPEs, because Danny's they're gonna need them on the school side. And the burn rates, which we were tracking on police and with Commissioner Calvin on fire, but there's constant burn rates there. He's gonna have constant burn rates with 26,000 students, 2,600 teachers, and then the ancillary staff that's involved. And obviously the cleaning. I know Pat is pursuing some more of those cleaning guns also. So that's an issue.
And like the mayor said, there's already been CARES Act dollars to provide some help with this as well, so. Thank you.
Any other questions or comments? Okay, thank you very much. If anything arises pertaining to COVID-19, coronavirus, we'll make you aware of it. If not, we are going, whether a challenge or positive, we'll be back here next Monday at 10:15, and on our continued efforts on enhancing and improving race relations and police relations. Stay tuned. I'll have some, after my continued conversations with our African-American Black community. We'll continue on, and we'll have some announcements coming very, very shortly. I want to thank the residents and business community again for collaborating, cooperating with us, because you've made a huge difference, as shown by the bar graphs Commissioner Helen Carlton Harris showed today, that we are single digits 3 days in a row over the weekend. So we are making progress. There is sunlight at the end of the tunnel. We have to stay vigilant. You could see there's a number of states across America who might have moved too quickly or not following everything that we're doing here, whether from Governor Baker on down, and now they're having to relook at their plans, step back, reshutter, and close activities. We do not want to do that. So let's stay ever vigilant. Let's wear the mask, especially when you're out and about. Let's wash our hands. Let's social distance. If you don't feel well, stay home, and then we'll continue to partner with Baystate and Mercy. Knock on wood, if and when a spike occurs, the hospitalization will be there, but we don't want to get to that point. So, surreal and extraordinary times, but we're resilient, and we'll get through it. God bless you all. Thank you.